Welcome to another deep dive here. And today we're going exploring the sometimes, well, pretty complicated world of pet bird diseases. We've got this really incredible resource. It's a textbook, actually,
Mhm.
made for like veterinarians, real in-depth stuff.
Right.
We're going to try to pull out the things that'll be super interesting, even if you're not, a bird doctor.
Yeah,
Yeah.
definitely. Birds as pets are becoming more and more popular, so understanding how to keep them healthy, it's really important.
Absolutely. And I think, a lot of people don't realize how much goes into it. This book we're looking at, it's like, whoa, it's intense. It starts off talking about, the basics, raising and feeding birds the right way, but then it just jumps right into all these different types of infections they can get.
Oh, yeah. Bacteria, viruses, you name it.
Fungi, even parasites.
Mhm.
Then it goes into like metabolic disorders, basically, problems with how their bodies work. And then toxicities, things they might eat that can make them really sick. Then, of course, how vets figure out what's wrong and how they treat it, which is a whole other thing.
Right, right. Diagnosis and treatment, it's a whole art in itself.
And then at the very end, it even touches on those diseases that can actually jump from birds to people, which is a little scary, honestly.
Mm.
So our mission today is to go through all of this and distill it down to like the really key insights, the stuff that, anyone who's interested in birds or even just wants to learn something new can really grasp.
Exactly. No need to get bogged down in the super technical stuff. We want those aha moments, the things that really stick with you.
Okay, so to kick things off, I thought we'd start with a bit of a historical perspective because, people might not realize that humans have been keeping birds as pets for a long, long time. Like we're talking way back, ancient Egypt even.
Oh, yeah. They were huge on birds in ancient Egypt. Like, they actually revered certain birds as gods.
Exactly. And the ancient Romans, they were really into parrots, especially those that could talk.
Well, who doesn't love a talking parrot, right?
Right. And get this, there's actually writing from the first century AD that describes how they taught parrots to speak. They used like repetition and rewards, pretty similar to how we do it now. I mean, can you imagine like 2,000 years ago, people were already teaching parrots to talk?
That's incredible.
I know. And this whole bird keeping thing, it
Yeah.
wasn't just a passing fad either. It really stuck around. Like by the Middle Ages, even the Pope had official keepers for his parrots.
Seriously, official parrot keepers. That's amazing.
I know, right? And then you have all these famous figures throughout history with their pet birds. Henry VIII, he had an African gray. Charles II, he had a whole collection of these exotic birds. Like all through history, you see this connection between humans and birds.
It's fascinating.
Yeah, it really is. But then in the 1800s, it was like this whole other level. Keeping birds became like way more common for, everyday people, not just royalty and stuff.
Right. It became more accessible.
Exactly. In England, for example, budgies. Those little parakeets, they became super popular pets. People were keeping them in these elaborate cages, like real fancy stuff. But this whole rise in popularity, it also brought some, let's say, challenges, right?
Yeah, for sure.
I'm thinking specifically about parrot fever, those outbreaks that happened, especially in the late 1800s and early 1900s.
Oh, yeah. That was a dark chapter in the history of pet birds. As more and more parrots were imported, especially into the US, well, that's when things got a little bit, well, scary. Parrot fever, or psittacosis as it's called now, it's caused by a type of chlamydia bacteria.
And it can spread to humans, right?
Right, which is why those outbreaks were so concerning. They were even linked to the import of parrots from South America, which eventually led to a ban on importing parrots into the US in 1942. It was a pretty big deal.
Wow, I didn't realize it went that far. But in a way, those outbreaks, it was sort of a turning point, weren't they?
Absolutely. I mean, it really highlighted the need for specialized vet care for birds.
Because before that, I guess people just kind of figured, oh, it's a bird, any vet can treat it.
Yeah, kind of, yeah. But those outbreaks changed everything. It became clear that birds needed their own kind of vets, people who really understood their unique health needs.
And that's when avian medicine really started to take off, didn't it?
Yeah, exactly. More and more people were keeping birds as pets, and they wanted them to get the best possible care. So vets started to specialize in avian medicine, and eventually even organizations dedicated to bird health were formed.
Like the Association of Avian Veterinarians.
Right, which was formed in 1980. It's amazing to think that all of that was sparked by, a health crisis.
It's like sometimes bad things happen, but good things come out of them.
Yes, definitely.
Okay, so now let's jump into some of the specific diseases that this book covers. And man, are there a lot of them. We'll start with the bacterial infections, and one that really caught my eye was mycobacteriosis, which is basically avian tuberculosis, right?
Yep, that's the one. And it can be pretty serious.
Yeah, it sounds. What's interesting to me, though, is that it often doesn't look like what we typically think of as tuberculosis.
Right. You see, in mammals, TB usually affects the lungs first and
Yeah,
foremost.
those big, nasty tubercles in the lungs.
Exactly. But in pet birds, well, it's a bit different.
How so?
Well, you might see skin lesions or inflammation around their feather follicles.
Really? So nothing like the classic lung involvement.
Not always, no. See, the most common type of avian tuberculosis is caused by a specific bacterium called Mycobacterium avium. And with this one, those typical tuberculous granulomas, those clumps of infected tissue, they're actually less frequent in pet birds.
Less frequent, but they can still happen, right?
Oh, absolutely. They've been found in the lungs and the area around the eyes of some parrots. Also in the pericardium, which is the sac around the heart, of gang cockatoos.
Gang cockatoos, what a name, right?
Right. And even in the neck part of the esophagus, the food pipe, in blue-fronted Amazon parrots, sometimes it can even block the esophagus, which is obviously a big problem.
So even though it's less common, those granulomas can still cause some serious issues.
Yeah, definitely. But the key takeaway here is that lung involvement is not the norm in most pet birds infected with M. avium. Now, there are exceptions, of course. Canaries and goldfinches, for instance, they tend to get more typical lung infections with this.
Okay, so if it doesn't always look like typical TB, how do vets even figure out if a bird has mycobacteriosis?
Good question. Standard blood tests, they can be a bit unreliable.
Really? Why is that?
Well, the results can be inconsistent. Sometimes you get a false positive, other times it misses the infection altogether, so it's not the most reliable method.
Okay, so what do they do then?
Well, this is where those fancy molecular tests come in, like PCR.
PCR, that's the one you always hear about, right?
Yeah. It stands for polymerase chain reaction. It's basically a way to detect the bacteria's DNA directly in a sample. You can take a sample of feces, tissue, whatever, and the PCR will tell you if Mycobacterium DNA is present.
Wow, that's pretty incredible. So it's like a super specific way to identify the infection.
Exactly. And there are different types of PCR tests that can actually distinguish between the different types of mycobacterium that cause avian tuberculosis.
So they can even pinpoint the exact strain of the bacteria.
Pretty much, yeah. These advanced techniques are really making a difference when it comes to diagnosing these tricky infections.
So that's diagnosis. What about treatment? I imagine it's not as simple as just popping a pill, right?
You're right. It's definitely not a quick fix. Treating mycobacteriosis usually involves a combination of pretty strong anti-tuberculosis drugs, and it's a long-term commitment. Like, we're talking months, sometimes even close to a year of treatment.
Wow, a whole year. That's intense.
Yeah, it is. And you can't just use one drug either.
Why not? Wouldn't that be easier?
Well, the problem is that the bacteria can become resistant to a single drug pretty easily.
Oh, I see. So they have to use multiple drugs at the same time to, like, attack the bacteria from different angles?
Exactly. And even then, it's not always a guaranteed success.
So what kinds of drugs are we talking about here?
Well, the usual suspects are isoniazid, rifampin, ethambutol, things like that. But here's the thing. We don't really have a lot of data on how these drugs specifically work in birds.
What do you mean?
Like, we don't know exactly how they're absorbed, metabolized, excreted, all that stuff.
So how do they even figure out the right dosages for birds?
It's kind of crazy, but they often have to rely on information from studies done on human children because, there's more data available for humans.
Wow, so they're kind of extrapolating from human data to figure out how to treat birds. That's wild.
It is, yeah. But it's the best they can do in many cases. And, there have been some success stories. They found specific combinations of drugs that seem to work pretty well in certain types of parrots, at least.
So there's hope.
Yeah.
But it sounds like it's still a bit of a trial and error process.
Oh, definitely. And what works for one species might not work for another at all. For example, they found that certain combinations that seemed promising in the lab, they didn't actually clear the infection in, say, doves or budgies.
So it's a real species-specific thing.
Yeah, exactly. It just goes to show how much we still have to learn about treating these infections in the vast diversity of bird species out there.
Okay, well, that's a good overview of avian TB. Let's shift gears now to another bacterial infection that honestly gives me the creeps a little. Salmonellosis. I mean, that's something that we hear about all the time with food poisoning and stuff.
Yeah, salmonella, it's definitely not something you want to mess with. And for birds, well, stress is a huge factor in whether or not they get infected.
Stress, huh? So, like, what kind of things would stress a bird out enough to make it susceptible to salmonella?
I mean, anything that disrupts their routine or environment, like moving to a new cage, changes in their diet, being transported, even introducing new birds without a proper quarantine period, all of those things can stress them out and weaken their immune system.
So, like, even seemingly small things can have a big impact on their health.
Absolutely. And a stressed bird is basically a sitting duck for infections like salmonella.
So, keeping their stress levels low is super important. But what if a bird does get infected? What are the signs that something's wrong?
Well, that's the tricky part. In acute cases, you might not see any specific changes in their organs. They might just die suddenly without showing any obvious symptoms.
Oh, wow. So it can be that serious.
Yeah, it can be. But in more chronic cases, you might see some changes in their internal organs.
Like what kind of changes?
Well, you might see congestion in the lungs and intestines. Their spleen and liver might be enlarged. There might be tiny areas of dead tissue on the liver, things like that. But here's the fascinating thing. The specific signs can vary quite a bit depending on the species of bird.
Really? So it's not like a one-size-fits-all kind of thing?
Nope, not at all. For instance, in some smaller birds, they might develop these granulomas, those inflammatory clumps, similar to what you see in another bacterial infection called pseudotuberculosis.
So it can mimic other diseases.
Yeah, sometimes. And then you have wild songbirds, which often show inflammation in their throat and crop, sometimes with raw areas or even ulcers. European goldfinches, they sometimes get these lesions under their skin instead of in their throat.
So it can manifest in all sorts of ways, depending on the bird.
Exactly. And canaries, they might just look generally unwell with congested organs and dark intestinal contents, which is a sign of internal bleeding. Lories and lorikeets, they often have these tiny hemorrhages on their digestive organs and their heart. They can also have an enlarged heart chamber. And then you have macaws infected with salmonella. They can lose muscle mass, have a thick mucoid discharge in their intestines, and develop small, pale nodules in various organs.
It's like a whole different set of symptoms for each bird.
It really is. And even young budgies, they can develop this buildup of fibrinous material around their heart. Garden birds, they often have ulcers in the esophagus, inflammatory clumps in their soft tissues, enlarged livers and spleens. It's a real mixed bag.
Wow, that's incredible. So with all this variation, how do vets go about diagnosing salmonellosis in pet birds?
Well, it usually starts with taking samples. If it's a live bird, they might take a fecal sample or a swab from the vent and a blood sample. But if the bird, unfortunately, has died, then they'll take samples from various organs: the liver, spleen, heart, intestines, lungs, throat, brain, kidneys, pretty much everything.
So they're really trying to get a comprehensive picture of what's going on.
Exactly. And it's really important that they get these samples before they start any kind of antibiotic treatment.
Why is that?
Because antibiotics can actually kill off the salmonella in the samples, making it harder to detect.
Ah, that makes sense.
Sometimes they'll also take samples from the bird's environment.
Really? Like what?
Pool droppings, cage litter, dust, even food and water, especially if they're trying to figure out the source of an outbreak.
So they're doing a bit of detective work.
Exactly. And then, to make sure the salmonella survives the trip to the lab, they'll often put the samples in a special liquid broth and keep them cool during transport. It's all about preserving the bacteria.
Okay, so they've got their samples. What happens next?
Once they're in the lab, the samples go through a process called enrichment.
Enrichment, what's that?
It basically involves adding nutrients and other stuff to the samples to encourage any salmonella that's present to grow. Then they spread the samples on these special petri dishes that contain specific types of agar.
Agar, like that jelly stuff they use to grow bacteria.
Yeah, exactly. And they use specific types of agar that are really good at growing salmonella, like brilliant green agar or BGA and xylose lysine deoxycholate agar or XLD.
So like different agars for different bacteria.
Right. And on BGA, salmonella colonies usually look kind of raised, pale red, and translucent.
So they have a specific appearance.
Yeah, they do. And on XLD, they're red with black centers. And then there's another type of salmonella that produces these smaller, paler colonies on BGA.
Wow, so it's like a whole identification process.
It is. And if they find any colonies that look like they could be salmonella, they do a bunch more tests to confirm it. It's a very meticulous process.
So what about controlling and preventing salmonellosis in pet birds? I imagine hygiene is super important.
Oh, absolutely. Hygiene is key. So if you have a bird that seems sick, isolate it from the others. Clean and disinfect cages and everything in them, like food and water dishes, perches, toys, all of it.
So like a deep clean,
Yeah, a really thorough cleaning, and you need to use the right disinfectants.
like bleach.
Diluted bleach is good, yeah, or a commercial disinfectant specifically for birds. And if you suspect that the food is the source of the infection, well, you got to toss that out immediately and replace it with a fresh batch.
Okay, that makes sense. So let's move on to another bacterial infection that we kind of touched on earlier, chlamydiosis.
Uh,
It's also called psittacosis or, parrot fever.
yeah. Chlamydia, it has a long and interesting history, actually.
Oh, really? I didn't know that. Tell me about it.
Well, the chlamydia bacteria itself, it was first identified in the early 1900s. But the diseases it causes, like trachoma in humans, they were described way before that. Like, we're talking ancient Egyptian writings. That's how long we've known about this thing.
Wow, so it's been around for a long time.
Oh, yeah. But it wasn't until the late 1800s that scientists made the connection between chlamydia psittaci infection in parrots and a similar illness in humans.
Which is what we now call parrot fever, right?
Exactly. And in the late 19th and early 20th centuries, there were all these outbreaks of psittacosis in humans, many of which were traced back to infected parrots or other pet birds.
Hence the name parrot fever.
Right. And those outbreaks, they were a big wake-up call. The fact that this disease could jump from animals to people, well, it really made people take notice.
And I think you mentioned earlier that there were even some massive outbreaks in the 1920s and 30s that were linked to parrots imported from South America.
Yeah, those were bad. They had a major impact on public health. And even later in the 20th century, there were outbreaks in people working with poultry.
So it wasn't just limited to pet birds.
Nope. This thing can spread far and wide.
Yeah.
But getting back to chlamydia itself, it's a pretty unique kind of bacteria.
How so?
Well, for a while, scientists weren't even sure how to classify it. Like, is it a virus? Is it a bacterium? It has characteristics of both.
A real mystery bug, huh?
Yeah, kind of. But now the general consensus is that it's a bacterium. And there's one main genus or group called chlamydia, which includes a bunch of different species that can cause disease.
And the one that causes avian chlamydiosis is?
Chlamydia psittaci.
Got it. And that's the same one that causes psittacosis in humans, right?
Right. It can infect both birds and humans, and it even causes a similar disease in poultry called ornithosis.
So this one little bacterium can cause a lot of trouble.
You said it. And what makes it even more intriguing is its life cycle.
What do you mean?
Chlamydia has this weird three-phase life cycle that allows it to really effectively infect cells.
Okay, break it down for me. How does it work?
So it starts with this tiny, tough little particle called an elementary body, or EB for short.
The elementary body.
Yeah, it's the infectious form of the bacteria. And these EBs, they're like tiny armored tanks. They have this rigid outer layer that lets them survive outside of a host cell for quite a while. So they can hang out in the environment just waiting for a chance to infect a new host.
So these EBs, they're like the little seeds of infection.
Exactly. And when they find a host cell, they attach to it.
And I imagine they have some way of, like, finding the right cells to infect.
Oh, yeah. In birds, they usually go for the cells lining the intestines. And this attachment process, it's actually pretty complex.
Really? How so?
Well, first, there's this initial attraction phase. It's like the EBs kind of feeling out the host cell. And then once it finds a good spot, it binds to the cell's surface. This binding involves specific proteins on both the EB and the host cell, like a lock and key type of thing.
So it's a very specific interaction.
Very. And once the EB is securely attached, well, that's when things get really interesting.
What happens then?
The host cell actually engulfs the EB.
So the cell basically eats the bacteria.
Yeah, kind of. But here's the crazy part. Instead of being destroyed by the host cell, which is what you'd expect, the EB ends up inside this little compartment within the host cell. It's like a little bubble.
So it's protected inside the cell.
Exactly. And over the next few hours, this compartment moves toward the nucleus of the host cell. And in C. psittaci infections, they've actually identified specific proteins that the bacteria uses to kind of hitch a ride on the host cell's internal transport system.
So it's manipulating the host cell to get where it wants to go.
Oh, yeah, chlamydia is very good at that. So
Yeah.
once it reaches the nucleus, the EB transforms into a reticulate body.
A reticulate body. So it's like changing form.
Exactly. And this reticulate body, it's bigger and more fragile than the EB, and it's no longer infectious, but it can replicate like crazy.
So it's switching from a survival mode to a replication mode.
Precisely. And it starts producing all sorts of proteins that it needs to survive and replicate. And then these reticulate bodies, they start changing again.
Again. So they go through another transformation.
Yep. They become intermediate bodies, which have this characteristic dense core. And finally, within about 30 hours of that initial EB entering the cell, these intermediate bodies mature into new EBs.
So the whole cycle starts over again.
Exactly. And all of these new EBs, they're contained within this compartment called an inclusion body.
An inclusion body.
Yeah, it's like a little factory for producing more chlamydia.
Right.
And each inclusion body can contain hundreds, sometimes even thousands of new EBs. And eventually, these inclusion bodies move to another part of the host cell called the Golgi apparatus, and that's where the new EBs are released to infect other cells.
So it's like a chain reaction.
Totally. And what triggers the release, they're not entirely sure, but it seems to be linked to the death of the host cell. Which, makes sense. If the host cell dies, the bacteria needs to find a new home.
So it's like an escape plan. But what if the host cell doesn't die?
Well, sometimes the chlamydia can actually establish a long-term infection within the host cell. It basically goes dormant, kind of like hiding out until conditions are more favorable.
Wow, that's sneaky.
Yeah, chlamydia is a master manipulator. And it's not just about replicating, it's also really good at evading the host's defenses.
Oh, really? How does it do that?
Well, first of all, when the EB first gets taken into the cell, it actually prevents the cell's normal waste disposal system from breaking it down. It's like it puts a wrench in the machinery.
So it's hijacking the cell's defenses.
Exactly. And then the compartment that contains all those replicating reticulate bodies, it becomes surrounded by these fibers from the host cell.
Fibers, like a protective barrier.
Exactly. It seems to protect the bacteria from leaking out and triggering a strong immune response. It's like a camouflage tactic.
So it's hiding from the immune system.
Pretty much. And then to top it all off, these compartments, they snuggle up to the host cell's mitochondria.
Mitochondria. Those are the powerhouses of the cell, right?
Yeah. Yeah. And chlamydia is basically stealing energy from them because they can't produce their own.
So they're like little energy vampires.
Totally. And they also rely on getting fats from another part of the host cell, which can disrupt that cell's normal function. So it's not just about hiding, it's also about using the host cell's resources to its advantage.
Wow, this bacteria is like a master criminal. So with all these tricks up its sleeve, how do you even diagnose chlamydiosis in birds?
It's a challenge for sure. There are several methods. One way is to try to actually grow the bacteria in the lab.
Like a culture.
Yeah, they'll use things like chicken embryos, lab animals, or cell cultures. And growing it in cell cultures is considered the most reliable method because you can actually see those inclusion bodies, those clumps of bacteria, inside the cells.
Ah, so you can see the infection happening.
Exactly. But this requires specialized labs with really high safety levels because you're dealing with a potentially infectious agent.
Right, of course. So are there any other ways to diagnose it?
Yeah, there are some tests that can detect specific chlamydia proteins, but those aren't quite as sensitive. And there are also tests that look for antibodies in the bird's blood.
Antibodies, those are the things the immune system makes to fight off infections, right?
Exactly. But the presence of antibodies doesn't necessarily mean there's an active infection.
So it could be a false positive.
It could, yeah. It could mean the bird was exposed in the past. Or it could be that the antibody levels aren't high enough to detect early in the infection.
Okay, so interpreting those antibody tests can be tricky.
Definitely. There are a bunch of different antibody tests available, and they all have their pros and cons.
So let's say you do confirm that a bird has chlamydiosis. What are the treatment options?
Well, the go-to antibiotic for this is doxycycline.
Doxycycline.
Yeah, and it's a fairly long course of treatment, usually 45 days.
45 days. That's a while.
Yeah, it is. But other antibiotics like tetracycline and enrofloxacin can also be effective. But doxycycline, it can sometimes cause side effects in some birds.
Like what kind of side effects?
Oh, they might get a little depressed, lose their appetite, or their urine might change color. If that happens, you got to stop the medication and give them some supportive care.
Right, make sure they're comfortable.
Mm.
So what about the dosage? Is it the same for all birds?
Nope, not at all. It depends on the species and the weight of the bird. The typical dose in food, it's around 300 milligrams of doxycycline per kilogram of food for those 45 days.
Okay, so that's if you're mixing it in their food.
Right. But for individual pet birds, vets often prescribe capsules that you give by mouth. And then there are injectable forms of doxycycline and a long-acting form of another antibiotic called oxytetracycline.
So a few different options depending on the situation.
Yeah, exactly. And it's important to know that if you're giving tetracycline by mouth or in food, you need to reduce the amount of calcium in their diet. because calcium can actually interfere with how well the drug is absorbed. It's a little thing, but it can make a big difference.
Okay, so that's a great rundown of chlamydiosis.
Yeah.
Now, this book also mentions a few other bacterial infections. Should we touch on those briefly?
Sure, why not? There's campylobacteriosis, which they say can be quickly detected using PCR.
PCR, our friend again?
Right. And then borreliosis, which is Lyme disease. That one's interesting because birds can actually be carriers of the bacteria that cause Lyme disease.
So even though they might not get sick themselves, they can still spread it to other animals.
Exactly. And the book even lists all these different types of birds and the ticks that are known to feed on them.
So it's like a whole ecological web of Lyme disease transmission.
Totally. And then there's mycoplasmosis, which is caused by these tiny bacteria that don't even have a cell wall.
No cell wall. That's strange.
Right. And apparently it often spreads at bird feeders.
Bird feeders, how does that work?
Well, infected birds, when they're at the feeders, they can release these tiny droplets that contain the bacteria.
Well, it's like airborne transmission.
Exactly. And in-house finches, they've found that the use of tube feeders, the time of year outside of breeding season and cold temperatures, all of those things are linked to a higher risk of infection with this one particular type of mycoplasma called Mycoplasma gallisepticum.
So it's like a perfect storm of environmental factors.
Yeah, kind of. And the symptoms of mycoplasmosis, they can be all over the place. Some birds get a runny nose and swollen eyes, others develop conjunctivitis, some even go blind.
Wow, that's scary.
It is, and they've even seen specific symptoms in young cliff swallows and European starlings that are infected with a different type of mycoplasma.
So again, it depends on the species.
Always.
Okay, what else is on the bacterial hit list?
Well, there's pasteurellosis, which is caused by a bacterium called Pasteurella multocida,
Pasteurella multocida. Got it.
and then colobacillosis, which is basically E. coli infection.
E. coli, that's another one you hear about all the time. So how does that affect birds?
Well, just like with salmonella, it often happens when they come into contact with contaminated sources. And again, stress plays a big role.
So keeping them stress-free is like the #1 thing.
Pretty much. In adult canaries and finches that die, they often find E. coli as a secondary infection.
Meaning they were already weakened by something else.
Exactly. And the symptoms, again, they vary. You might see lethargy, conjunctivitis, sometimes even septicemia, which is a